Hello, good afternoon. So my name is Timmy. I'm part of the dietetic team. I'm a dietetic intern with the dietetic team. Can you confirm your full name and date of birth for me, please?
Full name is Avolabi Johnson. Date of birth July 1, 1999.
All right, thank you so much. So as I mentioned, I'm a dietetic intern with the dietetic team, and your doctor has asked me to complete a nutrition assessment followed by a nutrition physical examination. So is this a good time for us to complete that?
Yes, works with me.
All right, thank you so much. So how would you describe your appetite today? Do you have an appetite this afternoon?
Yes, I do. I could use a sandwich or something.
Okay, and that's good to know. That's always exciting. Um, and have you noticed any recent weight changes?
Yes, I have actually. Personally, I've been trying to lose some weight and got on some, exercise and all that. I realize I've lost a little bit, but not significant. I would say probably like 3 pounds thereabout.
Like 3 pounds?
Yeah.
Okay. And how long did it take you to lose that weight?
I would say it's taken like a space of like probably over 2 months
Over
to
2
get to
months
that.
to get
Yes,
to
to
that,
get
okay.
to that place.
All right, so that may not be really significant if you've lost two over the last 2 to 3 pounds over the last 3 months, 2 to 3 months. That may be still within the usual body weight. And what is a usual body weight for you?
For me, it probably lies around usually it's gonna be like around 178, 179 thereabout.
178, 179 usual body weight. Okay, that is good to know. We will still go ahead and complete a nutrition focused physical exam. And in doing that, I would have to like to do an head to toe physical exam to check for muscle and fat depletion. I will be checking areas of your head, your face, areas of your shoulders, your torso, your arms, your legs, and just to confirm and to check for muscle and fat depletion. Would you be comfortable with me completing this today?
Yes, that's fine with me.
Okay. All right. Thank you so much. So I'm going to start just by checking areas of your hair. Have you noticed any recent changes, any hair loss recently?
Oh yes, noticed some hair loss. I always thought that was like genetic because
Okay.
my dad also lost some hair, but yeah, I've noticed some. So
Okay.
that's recent.
Is that usually typical around this time of the year?
I can't say that I'm aware of the time of the year that it happens, but I can say like yeah, it's obvious.
Okay. Let's see. And I think everything looks okay. The hair may be moving backwards, but no major hair changes or hair loss on that.
Okay, that's good to know.
Super. Okay. So I'm gonna go to areas of your eyes. I would move from left to right. Can you follow my fingers? Just follow my fingers. That's good. Follow my fingers to the right. That is good. Okay. Up. Thank you. And then down. Okay. Thank you so much. So I will ask you to just pull down your lower lid. If you can do that for me, please.
For both eyes.
For both eyes, yes. Okay, great. So good. Thank you so much. And now I'm going to be going to areas of your mouth. Have you noticed any gum bleeding or any changes in taste, anything like that?
Not gum bleeding, but what I've noticed is a sore. I've noticed sore tooth. I usually was fine, like eating like warm food, cold foods, but recently I've noticed like there's this sharp sensation every time I can like drink water. Sometimes when I chew gum too, I feel like a sensation at the lower, at the end part of my dentition.
Okay. So no bleeding gums, just
No.
some sensation
Yes.
when you do. It's okay.
That's
Any
correct.
mouth sores? Have you noticed any mouth
No,
sores?
no,
mouth sores.
that I'm
Okay.
aware of. Yeah.
Awesome. So I'm gonna start by just saying, can you open wide your mouth and then pull out your tongues for me, please? Okay, great. That is good. Can you also give me a big smile with your teeth shining out? Okay, that is good. Okay, thank you. I'm gonna also ask you to pull down your lower lips. Thank you so much. Okay. And then I'm gonna go to areas of your face. I would be checking and palpating the areas of your face. I'm gonna warm my hands a little bit so it's not too cold in here.
That's okay.
Absolutely. Okay, can you punch your jaw? Just punch your jaw, and then relax a little bit. Okay. And then you can relax a little bit. Okay, that's good. Checking areas of your eyes as well. Okay. And I'm gonna go over to your cheeks. And I'm gonna go over to your clavicle. So you're on the shirts, and I'm just gonna go over those shirts. Okay, that's good. Check the left areas of your clavicle as well. Alright. Now I'm gonna be checking your shoulders. Can you bend your arm to 90 degrees for me, please? Thank you. 90 degrees. Thank you. Then straighten that. Bend it again to 90 degrees. Just checking for some defletion over here. Seem to have good muscles over here.
I'll take that.
Okay, looks good. Then I'm gonna be checking areas. Let me do the same thing for your other end. Straight that out. Back to this. Okay, thank you. And I'm gonna just ask you to check the fingernails. And for the other end as well. So check your fingernails. Okay, thank you. Alright, I'm gonna ask you to sit upright. Just sit upright, thank you. And check in areas of your back. Oh, can you extend your hand? Just extend your hand straight up. Okay, thank you. Just checking areas of your ribs to check for some fats. And then checking areas of your hip bone. Good. And doing the same for the other end, areas of your hips and then the hip bone as well. Alright, thank you so much.
Okay.
Then I'm gonna have you maybe just, if you don't mind, if you wanna sleep, and then that way I could sleep facing the side, and then lift your legs a little bit. So I'm just gonna check areas of your legs. The other way around.
Oh, yeah.
Exactly. And then lift your legs just like this. Perfect. The other one also like that. No, just like this.
Okay.
Exactly. Okay. Thank you. And then push your legs towards me. Nice. Good. And then I want you to move your legs as if you're pressing the pedal. Good. And back again. Good. Okay. The same thing for the left leg. Push towards me. Okay. Then can you push as if you're pressing the pedal? Thank you. Okay. Great. Thank you so much. Seem to be doing well. No
Okay.
major muscle or fat depletion, which is good.
Nice to know that.
Great. I'm just going to ask, have you noticed any swelling on your feet, on your legs?
I think I noticed some recently, and I think you might, especially like when I put on a sock or like
Okay.
a shoes and I take them off.
Okay.
I noticed like a little bit of swelling. I don't know if that's
Okay.
just from like the fat or whatnot, but
Okay.
I've
Possibly.
noticed that.
Do you mind pulling off your socks for me, please? I
That's
just
okay.
want to check.
I'll
and
do
see.
that.
Okay. Thank you so much.
There we go.
Can we just check and see if there is any? Okay. I do not see any fluid retention or any edema. It's probably maybe some because of the socks.
Okay.
It's good to know. So now we're gonna just go ahead and complete a pulse. We're gonna check your pulse and then check your respiration and how you're breathing. And after that, we'll go ahead and check your blood pressure. Is that okay if I go ahead and do that?
Yeah, that's
Okay.
fine by me.
Awesome. Let me start by checking your pulse, if you don't mind, just your left.
Do I need to take any of this?
I think this is fine. I'm just gonna go through this. We'll be checking this and just stay in here for like 30 seconds.
Okay.
Okay. Okay. Pulse looks strong. And I'm gonna check your respiration if you want to sit upright also. Okay. Just breathe normally. I'll check that for about 30 seconds as well. Breathing looks okay. Okay. Your breathing looks okay. Thank you. Now we're just going to check for any dysphagia, any chewing. Have you noticed any chewing or swallowing difficulty? Do you have anything like that?
No, aside the one that I mentioned regarding like just the sensation that I feel, I don't think there's any discomfort that I felt, while chewing.
So does that affect when you go out to eat? Does that affect the amount of food you eat?
No, it doesn't. I still finish my whole bowl of food.
Okay. So I could hear you say no major chewing or swallowing issues.
No,
on this one.
not that I'm aware.
Awesome. That is good to know. And I think we'll also just go ahead and check for your blood pressure.
Awesome.
And after the blood pressure, we'll also do a neural exam. Or let's do the neural exam,
Okay.
and then we're going to conclude with
The blood pressure.
the blood pressure. Does that sound good?
Works fine.
Awesome. So can you confirm today? What's today's date?
Today is August 3rd, 2025.
Okay. What day of the week is it?
Today is a Sunday.
Who is the president of the U.S.?
It's Donald J. Trump.
Donald J. Trump. Thank you so much. Apples, pears, and pineapples. What are those?
It's a fruit.
Those are fruits. Okay. Thank you so much. And tables, chairs. What are those?
It's a furniture.
Those are furniture. All right. Thank you so much. Right. So after this, we'll just go ahead and then complete the blood pressure. All right. So we're going to conclude with the blood pressure. I'm going to put this in your left hand. So let's go ahead and do this. Great. There we go. Awesome. If you can just let it rest over there. How does that feel?
Feels firm.
Good. So we'll be inflating this and then for 30. Okay. Looks like that's staying around 122. Alright. So we'll wait for about 30 seconds. And then we're gonna try and get a systolic as well as the diastolic again. Okay, so I'm gonna go ahead and then just
22, it was 75.
Good. All right, so with that, we conclude our nutrition assessments. Thank you for your time today. We'll let you know if we have anything to discuss and then reach out to your doctor as well.
Thank you so much.
You have a nice rest of your day.
You too.
Bye.